Good afternoon, everyone. My name is Zubair Ansari, and I'm an assistant professor here at Bascom Palmer Eye Institute, and I happen to also be the medical director of outreach as well. I have the unique privilege of talking about our Healthy 33136 project, a project that has been conceived to basically combat the preventable blindness that we see here in our community, a project that we're really enthusiastic about getting off the ground here in 2022. I have no financial disclosures, and I first wanted to lay out some groundwork for some of the statistics and things that we deal with in global ophthalmology. So the World Health Organization recently estimates that 2.2 billion people worldwide suffer from visual impairment. And unfortunately, when you look at that number, the bulk of that visual impairment is actually considered to be preventable. So those folks that suffer from cataracts, glaucoma, or refractive error, which can be easily corrected if the patient had access to medical care. And so oftentimes when people approach me, they talk to me about global ophthalmology and they get excited about the prospect of working in an international community, doing cataract surgery or doing medical screenings in an indigent area. But I like to recalibrate that thinking in a way to basically try to focus not on an international setting, but in settings that there are disparities. And we know that those disparities exist here in our own backyards. In fact, there are numerous studies that have shown that health disparities exist within minorities or marginalized groups. The studies have confirmed that the disparities can sometimes involve access, quality, and the outcomes of care with regards to race and ethnicity here in the United States. And lastly, and more worrisomely, is that studies have shown that the gaps seem to worsen during times of economic hardship. And so enter into our community, 33136, which is a beautiful and vibrant community, which has a pretty significantly diverse population. In fact, the most recent census showed that 47.5% of our population happens to be of Latin descent. And of the remaining 50% that isn't Latin, a great preponderance of that happens to be African American or Black American. So incredibly diverse. We unfortunately know that 33136 happens to be one of the lower income counties, not only in Miami-Dade, but also in and around Florida. So the median household income is estimated in 2021 to be $30,000. That's significantly lower than the average, which happens to be about $60,000, so almost double it is compared to other counties. So our proposal, our modest proposal, is to basically try to characterize the burden of visual impairment and loss in our community. And we want to not only look at the numbers in terms of how many folks are suffering from cataract blindness, macular degeneration blindness, glaucoma blindness, but to also analyze the psychosocial factors that play a role in this as well. Could it be that patients are lonely? What other barriers do they have in terms of accessing healthcare, like transportation? What is the financial implications of this? What is the estimated value of time lost for patients who can't return to work based on the fact that they have a cataract or a preventable visual impairment? And so by doing this, by analyzing those factors, we hope to develop public health frameworks to improve visual outcomes, not only here in 33136, but in demographics that are very similar to ours around the country. And so our methodology is really going to consist of this large vehicle that we have parked outside of our hospital here, which is the Vision Van, which has been a generous gift to us by the Lazar Foundation and has been deployed in a number of our healthcare screenings previously, namely our Docs program. And so we are planning on deploying our Vision Van along with our know-how. So that's our know-how is our technical support, our group of excellent physicians and faculty that we have here, our residents, technicians, and volunteers to basically seek out areas in 33136 that have a high prevalence of visual impairment. By by doing the study, we basically are going to begin with something called a RAB study, and I'll go into what a RAB study is in a later slide here. But the ultimate goal is to find and refer and treat these patients at Bascom Palmer, then longitudinally track their visual outcomes over a period of time. So a RAB study, what is a RAB study? A RAB study stands for a Rapid Assessment of Avoidable Blindness study. It was developed by the London School of Hygiene, and it's actually been employed for multiple years in areas around the world, namely in Africa and places in India, to characterize the cost or the epidemiology, if you will, of visual impairment in those areas. Interestingly, it's never been done in the United States or even higher income countries. So the number one question we want to ask ourselves is the RAB study going to be valid in a population of ours? And if it is, great. If it isn't, what tweaks and modifications need to be made so that it can be valid in our study? We know that the RAB is incredibly useful in characterizing visual impairment in a very rapid way and a low cost way as well. So I just wanted to lay out kind of the three main steps of this ongoing project. First, obviously, we'll be screening, that is analyzing the data, allocating resources to a specific pathology. We recently hired a coordinator for our program who will be assisting us in navigating those patients to our facility to be followed over a period of time. We'll employ our social work program to obtain insurance for patients when possible, particularly if they're residents of the 33136 zip code. They may be eligible for the Jackson PhD Trust program. And along with that screening project, we'll include a number of surveys and questionnaires to address specific psychosocial barriers and transportation barriers and financial barriers for patients. After we screen patients, we obviously want to intervene when possible. That will require navigating patients, the Bascom Palmer, and tracking their outcomes. It'll also require us to going back and developing methodologies that may improve our screening technologies in the future in areas of high need. And once we've completed our interventions and screenings, we obviously want to know how good did we do. And the way to do that is to do a post hoc analysis that will include a repeat RAB study to understand what the burden of blindness is and how did we address it. And then lastly, developing methodologies to improve long-term care to our most vulnerable patients. And once we show that, or if we can show rather that the project is successful, can we increase the catch geography? Can we increase our zip code to 33136 and 1337 and other types of areas around Miami-Dade and Broward counties? And so it's always a luxury to have such an excellent group of physicians and medical students and residents that work with us, but we always need more help. And I always tell folks the main things that we need to do or have for this project to be successful. Number one is funding. Obviously, we need items for our screening. We obviously want to defray medical and surgical costs as much as possible for the patients that get screened to our hospital. And then we obviously want to try to see if we can have a full-time technician or other support staff that might be able to make this a primary goal or a career-oriented goal for them. And so funding will always be important. We obviously would love to have boots on the ground, volunteer work, people getting their hands dirty, checking patients' pressures or visual acuity, or just being an assistant in terms of navigating patients to the right area. We always need to help connect with connections, specifically with local partners, residential buildings, philanthropic organizations that may be interested in being a part of our project. We're open ears and open arms to everyone. And so, having those connections will be vitally important moving forward. And, as physicians, we're not very great event planners or media, experts. So it's always helpful to have folks that are experienced in those avenues to be able to assist us in terms of getting the word out for a project and really getting legs on this endeavor. So I really want to thank you for your time and attention to this project. I look forward to discussing this more with you all in due course. And feel free to reach out to me at any time for any more questions. And for those of you who are interested in volunteering, please, please, please reach out to me. I would love for us to have you involved in what we do. And so with that, I thank you for your time, and I look forward to meeting you soon. Thanks.